Welcome. It's been a year since many of us gathered in Anaheim to imagine what NUHW might accomplish during our second decade. Needless to say, we didn't imagine a pandemic that would cost one of our members her life and turn many others from hospital workers into hospital patients. It's important to start by recognizing what a difficult and frightening year this has been, and accepting our priority to keep our members safe must continue for months to come.
We want to acknowledge the bravery all our members have shown, the trauma many of us have endured, and the challenges we are all continuing to face together. We also must grieve for who we've lost.
Rhoda Vicuna, a nurse at Kindred Hospital Brea, was 46 years old when she died on May 29th. Like so many NUHW members, including dozens who have survived COVID-19, Rhoda and her colleagues were denied appropriate PPE and COVID tests by their employer. Rhoda's colleagues banded together to address these issues at Kindred Brea, but they still exist in many other facilities today. Rhoda is survived by her husband, David, and her children, Miguel and Abigail, and her siblings, including her sister, NUHW member Olivia Laharde.
Rhoda loved her job, and she cared deeply for her patients. Let's take a moment of silence to honor Rhoda.
There's an old adage that adversity doesn't build character, it reveals it. And we should be proud of the character, resilience, and relentlessness that we've shown over the past year, especially over these last 6 months. Here are just a few examples of the courage our members have demonstrated during this crisis.
When Queen of the Valley Medical Center in Napa started backsliding on its COVID-19 safety measures, in order to maximize elective procedures, NUHW members immediately spoke up. We put the hospital on the defensive with articles in 2 major newspapers. Before the second article even went to print, the hospital had recommitted to enforcing its safety protocols, although more must be done when it comes to PPE and testing.
At Children's Hospital Oakland, where several of our members contracted COVID-19, workers throughout the hospital are continuing their fight for a safe working environment, including appropriate PPE, access to testing, and fully paid leave for COVID-related loss of work.
At Santa Rosa Memorial Hospital, our members held a 5-day strike in July to stop Providence St. Joseph, one of the most profitable hospital chains in the country, from cutting benefits during a pandemic. At California Pacific Medical Center, our members have come together as never before to not only win a short-term contract, but to also fight for everyone's right to appropriate PPE. At USC Keck, our members have built their strength over the past year, not only to win a good contract, but to secure some of the best COVID testing and safety protocols we've seen in California.
Our Kaiser members have fought together to protect their right to a safe work environment and to speak freely about their employer while helping patients cope with the intense trauma stemming from the pandemic. Shortly after the pandemic hit, Kaiser illegally attempted to force our members to accept a side letter to their contracts that would have prevented them from organizing patients or sharing their concerns with the public, including journalists and elected officials. But our members made it clear they would never sign such a gag order, and Kaiser backed down. At the same time, most of our Kaiser members succeeded in winning the right to provide mental health treatment from their homes to lower the risk of COVID-19 infection for themselves and their patients, most of whom do not want to risk visiting Kaiser clinics during the pandemic. Rhoda's colleagues at Kindred Brea and their fellow caregivers at Kindred Westminster fought hard to force improvements to protect themselves and their patients. At Brea, where 27 workers contracted COVID-19 during a major outbreak, NUHW members forced management to create a dedicated COVID-19 unit to test all workers and newly admitted patients and provide hazard pay. Initially, Kindred management in Westminster refused to implement these same safety protocols, but under the threat of a second picket line, management backed down.
And finally, workers at Fountain Valley Regional Hospital held protests and filed a complaint with the California Department of Public Health that forced management to start safely cohorting COVID-19 patients. In response to the subsequent investigation, the hospital immediately stopped placing COVID-19 patients in the same unit with non-COVID cancer patients. NUHW members are continuing to push for mandatory testing for all newly admitted patients, appropriate PPE, and regular testing for all caregivers.
The risks so many of us face at work are compounded by the huge challenges we face at home, trying to balance a job with family commitments when most schools remain closed.
Helping out elderly neighbors and other loved ones.
Trying to make ends meet with fewer shifts to work.
Confronting the loneliness of sheltering in place and not being able to see the people who mean the most to us.
Watching the murder of George Floyd, knowing that it could just as easily have been you or your brother or your son, or for many of us, grappling with the true nature of racism in our nation, how little progress we've actually made, and how much must still be done. These are hard times, and folks are making painful sacrifices. We have people in our union who won't sleep in the same bed as their immunocompromised spouses because they don't know if they have COVID, and they don't want to risk infecting them. We have people in our union who haven't seen their kids in months for the same reason.
This pandemic has revealed what we're all about as people and as a union, but has also revealed what the healthcare industry is all about. And as the old saying goes, they are who we thought they were: greedy, ruthless, and cruel.
If you think your employer is doing a bad job at protecting your health during the pandemic, you're absolutely right. No healthcare company has enough PPE. No healthcare company is providing enough COVID-19 testing, with the exception of nursing homes, which are subject to state testing guidelines. Our just-in-time corporate healthcare system didn't have the staffing necessary to deliver adequate and safe care before the pandemic. Instead of meeting this challenge, the industry has actually pressured state and federal regulators to reduce safety standards and pawn off testing to public agencies.
We live in a world where healthcare corporations posted billion-dollar profits year after year, but their stockpiles of PPE were expired or not even medical grade. Where health insurance companies are making record profits because people are delaying routine medical care, but caregivers are losing shifts and struggling to support their families.
We live in a world where people are dying of COVID-19 in their homes because they can't afford to see a doctor or go to the hospital. Where professional athletes are getting tested at least every other day, but most healthcare workers can't get tested at all. Our system is seriously messed up, and we need to change it.
One way we can change the world is to work towards changing who's in the White House next year. But it's not enough to elect Joe Biden and Kamala Harris. We need to make sure California has a congressional delegation that will push President Biden to make bold reforms, especially when it comes to achieving Medicare for all and parity for mental health care.
We need to elect state lawmakers that will pass legislation making California the first state in the union to achieve a single-payer healthcare system. And we need to elect local lawmakers who will reform police departments, hold officers accountable, and invest in community services that have been squeezed under the weight of excessive public safety budgets.
Another way to change the world is to confront the realities of racism. It's not just law enforcement, it's everything. It's our employers, it's our healthcare system, it's our institutions, and yes, it's our union as well. NUHW stands in support of the movement for Black lives. That means addressing racism on the job, confronting it in our own ranks, and supporting in any way possible our Black siblings in the fight for justice. As a start, we have committed $25,000 to start an ongoing anti-racism training program for both stewards and staff members. The training will begin later this year.
I've been doing this work for 40 years. There is no parallel to 2020. But for me, I keep thinking back to the early 1980s when the AIDS epidemic hit. Many of our members were terrified to take care of people with AIDS. And President Reagan ignored the crisis. He never even publicly mentioned AIDS until 1985, long after it had killed thousands of people. The need was so great back then that I volunteered providing in-home care to men who were frail, frightened, and dying alone. That was one of the most formative experiences of my life. It helped form the values that I've brought to every job I've done. Values that are at the heart of NUHW. We're not only fighting for good contracts, we're fighting oppression. We're fighting bigotry. We're fighting for a better world. Back in the 80s, our union at the time, Local 250, developed the nation's first program educating healthcare workers about AIDS. We also became national leaders in defining that the mission of healthcare workers was to ensure that everyone receives equal access to compassionate care. Fast forward to today, and we are taking the lead on fighting COVID-19.
We crafted a Bill of Rights that spells out exactly what healthcare corporations have to do to protect people's health during this pandemic and future ones.
We are pushing hard to compel state leaders to mandate healthcare workers in hospitals, correctional facilities, and home health agencies are tested at least once a month for COVID-19. In May, the California Department of Public Health mandated testing for workers and patients in nursing homes, and our members report that it has made a big difference. There's no reason not to extend those protections to other healthcare settings where COVID-19 patients are treated. Our testing proposal also requires COVID tests for any healthcare worker exposed to the coronavirus or showing symptoms. Additionally, we are calling for hospitals to test all patients upon admission because many of our members who have been infected got COVID-19 from treating patients who they were told didn't have the virus but later tested positive.
We are continuing to push for more PPE, including taking our concerns directly to Governor Gavin Newsom. In July, Newsom mentioned our warnings about PPE shortages during his regular COVID-19 update when he announced a new push to provide more N95 masks. Before the pandemic, a caregiver could be disciplined for treating a patient with a highly infectious disease and not immediately discarding their mask. Now, during a pandemic, hospitals think it's okay to make people reuse masks over and over again. It's not okay. It's dangerous. And we won't stop until everyone has access to appropriate PPE.
In the wake of the pandemic, we expect to see big increases in demand for mental health care. In collaboration with our clinicians, we have developed a plan to help meet the need. Our plan includes expanding and diversifying the ranks of clinicians, safeguarding the right to receive care, and providing clinicians with more input into how mental health care is delivered. Our healthcare system is obscenely profitable and morally bankrupt. We have to fight just to have health coverage that we can afford to use. Latinx people account for 39% of California's population, and as of last month, 59% of documented COVID cases. A study of the Mission District in San Francisco showed that Latinx people accounted for more than 95% of positive COVID-19 cases, and that 90% of individuals with positive tests had been unable to work from home. Recent federal data shows that African Americans and Latinx people across the country have been 3 times more likely to contract COVID-19 than white residents, and nearly twice as likely to die from it. None of this is a coincidence. It's the result of an economic system that refuses to prioritize worker safety and a healthcare system that caters to the wealthy. And that is why we are continuing to be a driving force in healthy California now, and are helping lead the push to make California the first Medicare for all state in the nation.
If you want to understand what's wrong with our healthcare system, look at Seton Medical Center just south of San Francisco. There is nothing wrong with this hospital. But at one point, it was about a week from getting shuttered by its private equity owner for one simple reason. It serves a primarily immigrant, lower-income community that doesn't have high rates of private insurance to generate big profits. It was left for dead, and our members fought like hell to save it. Together, we worked with local political leaders to first get the state to save it as a designated hospital for COVID-19 patients. Then we worked to find a new owner for both Seton Medical Center and Seton Coastside Hospital. We succeeded. But do you know the first thing that the new owner is trying to do? Force all of its employees, including NUHW members, to accept huge takeaways.
That's our healthcare system in a nutshell. We see it at Seton, and we're seeing it in Santa Rosa, where Providence St. Joseph Health somehow has made a $201 million operating profit running Santa Rosa Memorial Hospital over the past 3 years. Where are those profits going? Not to patient care. Providence actually laid off caregivers 2 years ago. Providence isn't sharing its profits with workers either. It wants takeaways at Santa Rosa Memorial. Providence is demanding that workers pay twice as much for their health care and accept cuts to their paid time off during this pandemic. Winning a fair contract at Santa Rosa Memorial and protecting our members at Seton Medical Center and Seton Coastside are 2 of our top priorities over the coming year.
And this next year is going to be a busy one. Our top priority remains keeping everyone safe. But a majority of NUHW members will be back at the bargaining table before we hopefully meet in person for our 2021 Leadership Conference. We'll be bargaining with employers who are going to cry poverty in the worst economic climate of the past decade. That doesn't mean we can't win good contracts, but we must be unified and resilient.
For the past 6 months, keeping our members safe has been our top priority, and we continue to work very hard to build and strengthen our union. We are continuing to hit way above our weight in Washington, D.C., and Sacramento, where we are making strides in improving access to mental health care and pressing for more COVID-19 testing and PPE. We've settled multiple one-year contracts in recent months to lock in strong raises during the pandemic while giving stewards more time to advocate for safe working environments. We expanded our assortment of online continuing education classes that can be found at nuhw.org/ce. We are also proud to welcome to NUHW our newest members, WellPath employees at Stanislaus County Jail and Sonoma County Jail. These folks organized during the pandemic and defeated WellPath's attempt to block a vote-by-mail election. And we also welcome caregivers at Kindred Santa Cruz, residual units at Hazel Hawkins, Salinas Valley, Keck Hospital of USC, Elk Grove Unified School District, and Marin General Hospital.
Our Kaiser members have a lot to be proud of. They went through a very difficult 18-month negotiation. It didn't end the way we wanted, but many of them have put their energy into convincing state lawmakers to pass one of the most important mental health care reforms of the past decade. We have begun a contractually mandated 6-month collaboration with Kaiser Management to create a new model for delivering mental health care, one that doesn't make patients wait far too long to see their therapists.
We're working in good faith to see if Kaiser Permanente will finally work with us to achieve parity for mental health care. However, given our past experience with Kaiser, it's hard to be optimistic. So we are also putting more resources into internal organizing so that if we need to go into battle again, we'll be more prepared than ever.
We're all exhausted. There are times when all of us wonder how we're going to make it through another day. But there are also times when we can see a world of possibilities opening up. During the mortgage crisis more than a decade ago, millions of people lost their homes, and Wall Street firms swooped in like vultures to buy them up. We can't afford a repeat of that, with the insurance and hospital industries making out like bandits. The author Arundhati Roy recently wrote that nothing could be worse than the return to normality. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It's a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, or we can walk through lightly, with little luggage, ready to imagine another world, and ready to fight for it.
NUHW is only 11 years old. We've got a lot of fight in us, and a lot of heart. We look forward to the coming year, and hope we'll be able to greet each other with a hug in 2021.